he was told in Malaysia when they looked at his MRIs that like he needed disc surgery on his neck and his low back, and if he kept fighting, he was going to end up in a wheelchair. They told him all this stuff like this. This guy flies from Malaysia. My first visit with him, I listened to him. It might have been 10 minutes I had to listen. My session was 2 minutes. I mean, he came from Malaysia for that. Then I told, when they fly in, I said, I'll see you every day for X amount of days. He flew back. He was fine. So it's not a contest. I respect everything and healing, whatever. But, and here's the only but, I just want to say, but at the end of the day, every practitioner has a certain philosophy of healing. In other words, they have a philosophy of how healing happens. And every practitioner has a technique or several techniques, or maybe they made their own technique. So when you go to a doctor or healer, you're kind of encountering someone who is a combination of their philosophies of healing and their techniques of healing, and then they'll proceed with you. My only message to everyone is what I said before, is results. Because at the end of the day, if a woman has endometriosis, okay, well, who's going to do something about it? I mean, anyone can have any theory they want or a philosophy or a technique. But guess what? Dr. Pete's batting 80 for 80 on that, or whatever the exact number is. No one's ever come to me with endometriosis who didn't get healed. So my point is someone who has this, great acupuncturist, great homeopath, great naturopath, great energy worker, great chiropractor. Okay, well, here's the lady with endometriosis. What are you going to do about it? After all the fun and games and all the conversations, results are results. And I think Zone School is the king of results. So that's
This is the Wonder Network, where we discuss healthy options for humanity. I'm Michael Lane, and joining me today, with as usual, my co-host is Dr. Val. How you doing today, Dr. Val?
Pretty good, Michael. I'm hanging in there anyway. How are you doing?
I'm doing great, and I don't know about you, but I'm pretty excited with today's show. Someone that we haven't had on for a while. We will get into Dr. Pete Goldman is going to join us today as our special guest. And just for new viewers out there that don't know Dr. Pete Goldman, he was born and raised in New York City. He's founder of Zone School of Healing and the Zone Technique. In his chiropractor practice, he has had patients fly in to see him for healing from over 30 different countries and cities around the globe. Also, over 200 of his patients drive 4 hours each way for a 5-minute zone adjustment with him. Zone School has over 1,200 doctors and healers of all types as members worldwide and is growing fast. Zone School teaches the zone technique and healing knowledge not commonly understood or taught, resulting in superior results with musculoskeletal and non-musculoskeletal conditions. Dr. Pete has black belts in Brazilian Jiu-Jitsu and Kyokushin, and many of the best pro athletes in the world are his patients. Zone School has been featured in several magazines and newspapers, including the San Francisco Chronicle, Black Belt Magazine, and Chiropractic Economics. So how you doing today, Dr. Pete? It's been a while.
That was quite an intro. I hope I can live up to it. I'm doing great, and I'm happy to be here, and thanks for having me.
Well, it's been, I think the last time we talked, it was been over 8 months ago. Remember, we did a little live when you were in Berkeley.
We had a great time in person. I love that.
Yeah, I was in person at the hotel there, and if I recall, you were doing a training. If it was a training seminar there,
I was teaching a seminar in the San Francisco Bay Area, and we were lucky enough to connect, which I really enjoyed.
Yeah, it was. I really enjoyed it. So, being that was 8 months ago, what's new? What's happened? What's been going on with you and Zone Technique and your school and everything? What's been going on the past 8 months?
Well, it's interesting. I feel like it's almost like a continuum. In the early 1990s, I started learning what I know. And I started what you would call practicing in the mid 1990s. And I opened Zone School in 2017. And what's been happening since I saw you and what's been happening since Zone School opened, what continues to happen, two things come to my mind. One is Zone School continues to grow. I think in your intro, you mentioned 1,200 plus. I think we have like 1,700 plus at the moment.
Wow.
And doctors and healers all around the world who are Zone School members are helping their patients achieve healing results that the world would call miracles. I don't call them miracles, but that's what's been happening. More and more people joining and learning, and more patients healing.
So as we get that, so as you mentioned that, and for our new viewers, can you kind of explain exactly what is the zone technique and zone therapy? And is there a difference between the two, between zone technique and zone therapy?
Great question. So, and it's interesting, before I answer that, I think something kind of popped in my head, which I want to mention in kind of reference to what we first discussed a moment ago about kind of the evolution of Zone School and what's been going on. You know,
Sure.
I'm a chiropractor officially. You know, I have a chiropractic degree, but I'm a chiropractor in name only. Not that chiropractic is not great; it is great, but I don't. You know, I'm a chiropractor in name only, and I've kind of went with that for decades. With that said, when I first opened Zone School in 2017, I only taught chiropractors. It was just a school for chiropractors. So it was an online program, which it still is. Of course, I do teach in-person seminars. And when I opened it, it was only for chiropractors. And then it dawned on me that what I'm teaching, and I will answer that, what I'm teaching applies to any doctor or healer. You could be an acupuncturist or a homeopath or a naturopath or a Reiki master or a massage therapist or some kind of energy healer or a
Right.
remote worker, and can do this. And it's interesting. Not long after I opened Zone School, I opened it up to other doctors and healers. So now we have MDs, we have chiropractors, and any other kind of doctor or healer you could recommend. Excuse me, you could think of is in Zone School. But the funny thing is, when I first did that, I got a lot of very angry phone calls from chiropractors who said to me, "Hey, why are you teaching non-chiropractors?" They were very upset by that. And since I'm from Brooklyn, I was like, "Hey, F you." Just kidding. No, but I didn't really give them any explanation, but it's just interesting that, of course, I dismissed what they said, but it's interesting if I had listened to them, which of course I didn't even consider for a split second, but if I had, you imagine all the thousands of people who would not have been helped because all these other doctors and healers who are not chiropractors have learned this and they're helping people all over the globe, I think in 6 different continents. I don't think we've hit Antarctica yet, but I don't even know what's going on in Antarctica. If you talk to some conspiracy theorists, you're going to get all kinds of answers. But anyway,
Yep.
I don't want to go down that route because I'm not really an expert at it. But anyway, so zone therapy and zone technique, which you had asked about, there was a guy named Dr. Thurman Fleet who I really love. Just a spectacular healer. And when one evaluates a healer, someone might evaluate them by their philosophy. Like what is their healing philosophy? They might like it or they don't like it, or they kind of like it, or maybe their technique. Maybe someone says, "Oh, maybe I love acupuncture," or someone else doesn't want needles put in them, so they don't like acupuncture, or maybe someone loves energy work, but someone doesn't love energy work because they feel like they want to really be touched and they feel energy work is not enough for them. Who knows? But the point is this: people often will think about the philosophy of the healer or the technique of the healer and to kind of evaluate, do I like them? Do I not like that? Or, I mean, I don't mean personally, but do I like this? Do I not like this? Do I want to get this done on myself or whatever? But sometimes people forget about results. Like what are the results? Like what can who cares about what their philosophy is? Who cares about their technique? Like what can they do? Because if someone has like an autoimmune disorder, I would think they don't want to have it anymore. Like who's the one
Right.
you're going to go to that's going to help you have a healthy immune system? And if someone has debilitating migraine headaches, I would think they want to end up with a head that feels good all the time. They don't want
Yeah.
that anymore. And the woman with period cramps doesn't want period cramps, and the person with panic attacks doesn't want panic attacks. So the reason I mention that with results is that Dr. Fleet just got such great results, like such just mind-boggling results. I mean, people thought he was a reincarnation of something or something like that. I mean, this guy was getting these insane results of healing. And again, as we can all agree, like that just supersedes like, oh, this is how he was doing it, or oh, was he a chiropractor? Like I like chiropractors, or was he a chiropractor? I don't like chiropractor. Like, who cares? Like, here was this guy, Dr. Thurman Fleet, who just got these results that were mind-boggling. So he did invent something in 1931 called zone therapy to specifically answer your question. He invented zone therapy in 1931. And what it was a technique of healing. It was kind of a chiropractic based technique because he was a chiropractor, but again, he was a chiropractor in name only also. The technique transcended chiropractic. He just happened to be a chiropractor. Um, and what it does is it really says, is the brain balanced, like, or not? Like, is the brain balanced or not? That's the question. So let's say someone has an unbalanced brain, their brain is just not balanced. It's not monitoring the body properly, and it's not sending the proper signals to the body. Then, I don't know, one person gets, a digestive problem, another person gets a circulatory problem, another person gets a glandular problem or whatever, but it's due to, or a muscle problem, but this is due to the brain not being balanced. So Dr. Fleet, he figured out a way to quickly evaluate which brain centers are balanced and which are not. It was through occipital fiber palpation, which is very easy to learn. And then he figured out a way to gently stimulate the spinal cord, either through a chiropractic method or it could be an energetic method or whatever, to reset the brain centers in question. And that is a very, very, very brief summary of zone therapy. Now, I learned zone therapy just to bring you to zone technique because you asked about that. I learned zone therapy starting in 1993, and I was taught directly by four direct disciples of Dr. Fleet, and I spent over 100 hours each with them one-on-one. I mean, like one-on-one, just one, not like I was in some classroom. I mean, one-on-one, 100 hours plus with each of them over time. And I did zone therapy and I love zone therapy. And I already told you how great Dr. Fleet was. With that said, I've had many other influences in metaphysics, healing, martial arts, whatever. And I altered it a bit and I made zone technique in around 2002. Now, by the way, if you look at what I teach in zone school, if you look at the zone technique I teach in zone school, and you look at the writings of Dr. Fleet from the 1930s about zone therapy, you'll see several differences. There's several differences. And in zone school, whether someone joins the online program, which is the way to learn it, and or they come to live seminars, which is great too. What I teach is a little bit, maybe 20% of what I teach is zone technique. Like, how does one do zone technique? Again, you have to be a doctor or healer of some type, but you could be a Reiki master, you could be a chiropractor, you could be a whatever, whatever you do. Be a massage therapist, a physical therapist. I teach about 20% of what I teach is the zone technique, and about 80% of what I teach are principles of healing, of how healing works. Now, I know you didn't that's the answer to the question, but I just want to mention something which I think is worthwhile in our conversation. And if you think so, you can ask.
Yeah, please do. Please do.
Which is that there's a lot of confusion in the healing arts about what heals. Like, for example, let's say a chiropractor. Just we could use I could use many examples, but I'll just start with chiropractic. let's say a chiropractor goes to chiropractic school and they learn in chiropractic school, people are sick, when they're sick because their bones are out of place. Again, I'm not saying that's true. I'm just saying that is taught in chiropractic school for the most part. People
Right.
are sick because their bones are out of place, and those bones are pressing on nerves, and those nerves are sending the wrong information to the cells. So the chiropractor says, well, if I can find which bones are out of place and I can put them in, if I can then put them in place, then the person will heal. And again, I'm not saying that that's not true, and I'm not saying it doesn't happen sometimes. But the problem with a rigid thought pattern around that, if you said to a chiropractor, so let me get this straight. You're saying people are sick because their bones are out of place, and the solution is finding which bones are out of place and adjusting them into place so the nerves can flow properly and the body can heal. So the chiropractor would probably say, yeah, that is the cause of disease, and that is the solution. But you'd have to say to him or her, well, if that's true, then like, how does acupuncture work? Because acupuncture does work, but they don't care where the bones are. They're not checking your atlas or finding out what's misaligned or what has nerve pressure and putting things in place. They could care less about that. An
Right.
acupuncturist is looking at your tongue, feeling your pulse. That's how they determine which meridians or energy channels are blocked, and they put needles in to open up those energy channels, and people heal from that. So the chiropractor who thinks like, no, people are sick because their bones are out of place, they might get a little confused by that. Now, one can talk to certain nutritionists, nothing negative about nutritionists, but certain nutritionists would say something like, oh, well, as long as you're eating this or that, or you don't have enough, whatever in your diet. I mean, I don't know, is that really true? Because people go to, healer, the energy, they go to the Reiki master and heal. They didn't take these nutritional considerations, which you're saying are necessary. They're obviously not, because people are, so there's a lot of confusion about what is really healing, like what is doing the healing. Because most of the professions are sure that their way of doing the healing is the way healing happens. But if they give it some thought, they'll see it couldn't actually be exactly like that. So one of the things I teach in zone school is the common denominator of healing, like what heals. In other words, why does healing work when it works? Because some people go to a healer and they do get better. And why does healing not work when it doesn't work? And if one understands the principles of healing as I teach them, I'm not saying I'm the only one who teaches them. There may be someone, I mean, I don't know who else is, but there may be someone on this planet who understands it and they're teaching it. I don't know. But when they understand it the way I teach it, they'll understand, again, why healing works when it works and why it doesn't work when it doesn't work. And then we'll be much more equipped within the context of the type of healing they do to help people heal in a way that they certainly could not have before.
That brings up a question. I'm sitting here thinking about having had several zone treatments, which were spectacular, and feeling, I have one foot firmly grounded in science and the other foot firmly into woo woo. So, I've been an energy healer since I was a little kid. So, I'm always fascinated by this stuff. But as you're talking about the changes in the brain, it's kind of bringing up German New Medicine, because in that they're talking about how all diseases are stemmed from injuries to the brain, from whatever method it is that it's happened with, whatever kind of trauma, and they go about doing all kinds of things to remove that trauma or to allow the brain to heal. And so the thing that's interesting to me is that your technique is energetic. And so rather than, trying to let the body go through this whole point of healing the way German New Medicine does, this is, I think, more direct.
Well, a couple
And
things. Sorry, I didn't mean
yeah,
to interrupt.
and
Sorry.
yeah, and so, I'm looking at that and going, okay, if somebody really wants to get into really having some good results with healing, then even if they know something like German New Medicine, then doing the zone technique is going to be a heck of a lot quicker, And you don't have to have them go through getting tuberculosis and all these other things that happen that they say has to happen. You can still reduce the swelling in the brain with the energy. So I'm fascinated by that. So yeah, go ahead.
Yeah. So yeah, it is to be, just to clarify, it does on a physical level balance the brain. And I have a few
Mhm.
thoughts on what you said. So the first thing is, in no particular order, but the first thing is, yes, on a physical level, the brain is balanced. And of course,
Mhm.
there's this metaphysical. And when I say metaphysical, of course, physical is just the physical world, which we can perceive with our five outer senses. Meta is just a Latin word or a Latin prefix that means above or beside or beyond. So metaphysical means things beyond the physical, which in this example affects, or this conversation affects the physical. So there is this physical aspect of healing in the zone technique, which does involve the brain centers balancing. And there's this metaphysical aspect, which I just briefly mentioned. That's the first thing. The second thing is, again, as I mentioned before, results are results. Now, the types of healings that you kind of listed and mentioned, again, results are results. Like if someone went to a
Yeah.
practitioner of that type and they have like IBS or Crohn's disease, and then in the you know, not too long after that, after X amount of sessions, they had perfect digestion. Hey, pretty good. I mean, I tip my hat to them. Um, but what comes to mind as you talk about the new German medicine, if I'm saying the title right, it's almost like an AK practitioner. Now, I have nothing against AK. I mean, AK is a
Mhm.
very valid, fine, nothing even negative I could think about it. But the bottom line is this, and I can make the statement with utter assurity, because I know this for sure, and I'm happy to tell everyone how I know this, but I'll just start by saying it. You can go to, we'll call it a chiropractor who does AK, a very high level AK chiropractor, like a renowned AK chiropractor, who will spend 45 minutes per session and give, muscle tests and check different, remedies and it has validity, just like the German new medicine may have validity also. But I can tell you for sure, with 50 more for sures, that a good zone practitioner will get, I mean, 100, 10 times, 100 times, I'll just say infinitely better results than any AK practitioner. And it will take each session, instead of being 45 minutes, can take 3 minutes or 2 minutes. And the length of the treatment, the weeks or the months that it takes will be much shorter. And the results will be, that's the part, infinitely better. Because I know many, many, many renowned top, the most elite level. I don't want to pick on AK, but it just popped in my head. The most elite level AK docs, and you send them someone with some pretty severe conditions, they don't know what to do. I mean, they'll do the 45-minute muscle test, but 4 months later, that person's still going to be ill. You send them to me, they'll be better. So, and I've had so many AK docs who join Zone School say to me, hey Pete, I practiced chiropractic for 32 years, successfully. I had a good practice. I was pretty renowned. Had a good time, helped a lot of people with XYZ. And many of those who are AK docs say, Pete, I've been in Zone School for a year. I mean, I didn't know anything. I realized I didn't know anything. I'm doing stuff now in the last year that I couldn't have even begin to think that I could have done. So that's when I hear about things like the German new medicine or things like that. It's not that they're bad. There's nothing bad about them. It's just that the results are, for lack of a better word, inferior, highly inferior. So that's
Well, it takes too long. We have a world full of sick people. We don't have time to take weeks and months for people to go through all these different things to work at it, chipping at it a little bit at a time. We need something that works fast, and Zone does. It works really quick. And my other question, related to that is, how long does it really hold? And I realize that this is practitioner dependent, but like I've seen some people that have done the Zone treatment and it doesn't hold. They feel really good for a couple of days, just like with a lot of energy healings. They feel great for a couple of days, but then it doesn't hold. And so they go back. And I have one person that I referred who, it really didn't hold. And she went back for many, many sessions. So, to my way of thinking, it's like, okay, that's probably a practitioner thing.
You are
And some
100%
people
right.
can move energy and some don't do so well at it.
Yeah, you're 100% right. It's funny, even before I opened Zone School, just practicing for years, I'd have patients come to me and go, "Oh, Dr. P, a new patient. I love chiropractors and everything, but my adjustments just don't hold. My adjustments don't hold." And I tell them that's got nothing to do with this office. All my adjustments hold, all my sessions hold. So that's even before I
Yeah,
had
see,
Zone
that's
School.
you.
Yeah, right. So I just wanted to
Yeah.
say that is, and listen, there may be some exceptions there may be other factors that I'm not aware of, but that's a 98+% practitioner issue.
Mhm.
Someone doing the zones properly, like properly, the way I teach it, everything's holding. Holding. It's not
Mhm.
even, in fact, I wouldn't even, because to me, that whole polarity of like, is it holding, is it not holding? I'm not even in that polarity. Like, you come, you need to get healed, you need healing, you have this healing, move on to bigger and better things.
Well, it makes sense to me too, because with starting with entering the energy at the nape of the neck, that's a technique that a lot of healers do just unconsciously. Like I've been doing that for a long, long time. Never had anybody explain it to me, but it's like that's just one of the things you do. You concentrate the energy there, you send it up to the head, you send it down through the body, but it basically comes in at the back of the neck. And so, I find that very interesting too, because that clued me right away that yeah, this really is an energetic treatment that is causing a physical response. And
So
so that's fascinating. And I think most people aren't aware of that. So I did want to bring that point up.
thank you. And I just wanted to say one thing before we continue, because I'm listening to myself talk before. I don't want anyone to get the idea that I have anything against German New Medicine or AK or anything. I'm into results, period. So if someone's
Yeah,
like, wait a
me
second,
too.
I love my AK card. Good, you love your AK card. Good, keep going. And you're like, they help me so much. Good, I'm sure they're great. Or German New Medicine or whatever. I'm only talking
Yeah, it
about
all works.
right, right.
It's just
I'm
time.
only talking, yeah, I'm only talking about what I teach in zone school with zone technique and the principles of healing and getting these unparalleled results. So it's not a contest. I respect everything and healing,
Yeah.
whatever. But, and here's the only but. I just want to say, but at the end of the day, every practitioner, and I kind of alluded to this before in a different answer, every practitioner has a certain philosophy of healing. In other words, they have a philosophy of how healing happens. And every practitioner has a technique or several techniques, or maybe they made their own technique that they do. So they're kind of when you go to a doctor or healer, you're kind of encountering someone who is a combination of their philosophies of healing and their techniques of healing, and then they'll proceed with you. My only message to everyone is what I said before is results, because at the end of the day, I'm just making up random conditions. It doesn't matter. But if a woman has endometriosis, okay, well, who's going to do something about it? I mean, anyone can have any theory they want or a philosophy or a technique. But guess what? Dr. Pete's batting 80 for 80 on that, or whatever the exact number is. No one's ever come to me with endometriosis who didn't get healed. So my point is someone who has this, great acupuncturist, great homeopath, great naturopath, great energy worker, great chiropractor. Okay, well, here's the lady with endometriosis. What are you going to do about it? You gonna put it to bed or not? So again, I respect everything. No issue with any type of healing that we've mentioned, but after all the fun and games and all the conversations, results are results. And I think zone school is the king of results. So
And the
that's
thing too is like I'm always looking for the quick thing. Ever since I was a kid, I've always been looking for the one word or the one sentence that you could whisper into somebody's ear and they would instantly be healed because I know it's out there. And I remember that, but I don't remember what the word is. So, yeah, it's one of those things I've always been looking for. And I love all those other things too. And I refer people basically depending on kind of what I think is going to work with them. Like you said, if you're terrified of needles, you don't go to an acupuncturist unless they're going to do laser acupuncture on you, which does work, by the way. But still, all this stuff takes time. And so if somebody is locked into that mindset of, yeah, I got to have so many patients, and I have to spend so much time a day per week, etc., to pay the bills, then they might not be looking outside of their belief system. For me, I'm interested in results as well. I don't want to spend all day slaving over hot patients unless it's a whole bunch of them. You know, I want to see that stream, and I want results. And this is something that I find very valuable with Zone, because it does work. And in most cases, and again, I think it's just a practitioner difference that makes it maybe not work for some people, but and the patient's belief system too. So, like, what do you do if you have somebody that doesn't believe in any of this stuff?
Well, this is what there would be two types of people who, let's say, don't believe. So the first kind of person who doesn't believe is not in my office for healing. I just hear about them like, oh, someone comes in, they have a friend who needs healing, but they don't believe. I mean, what can I say? I mean, I don't have much to say. If somehow that patient of mine can bring their friend into the office, I'll do my best. So that's the first kind of person who doesn't believe but I'm not really in contact with them most likely.
Mhm.
However, the other kind of person who, quote, doesn't believe, but they kind of come into the office, but they don't quite believe, I have no problem with them because I remind them, if someone kind of comes in with a posture of, okay, convince me, I tell them real quick, I mean, I don't use these terms because I don't want to offend anyone, but my
Mhm.
my message is, hey, when you walked in my office, you didn't do me a favor, you did yourself a favor. So let's just start with that. That's number one. Number two, you're the one who's sick, not me. So if you want me to help you get better, I know exactly how to do that. And by the way, if I didn't think I could help you, I would tell you. I don't think we should get started because I don't think I can help you. But
Yeah.
which by the way, basically never happens. But the fact that you've come to me and are ill and you've told me what's wrong, and I'm telling you, okay, well, let's proceed because I plan to get you all better. Once I give them that kind of context reminder, we're good because I'm not there to play games with them. Like if they
Yeah.
actually want to heal, they came to the right guy. If they want to mess around, they can mess around somewhere else.
Yeah, I agree. I kind of have that very down to earth approach myself, and I have fired several patients, and I have sent other patients away where I said, I don't think that I can help you, and sent referred them to other physicians for whatever it was that they needed. But I think that the belief system or their stinking thinking is a problem with most of the more normal things. And I haven't had experience myself with zone therapy other than with myself, and it was great for me. I love it. But as
Yes, I
far as
agree.
doing it on someone else, that's a little bit different. But I mean, I've been dealing with people's stinking thinking systems for a long time, and it's one reason that there's certain types of people that I just won't even bother with, and I tell them, don't waste my time and your money. I'm just not interested in working with people that aren't 100% with the program with getting themselves healthy. So, with Zone, I think that you can get past that. That's my supposition anyway, that you can actually get past that with even the first treatment. And I think that's highly valuable, to wake up the inner will of the person to actually participate in their own healing.
Well, I had a cool story with someone just popped in my head. I think you'll enjoy it. I think the audience will enjoy it too. When people are in my school and understand how healing really works, because zone technique could be applied to any by any doctor or healer, chiropractors or any doctor or healer. I have one guy who just comes to my mind. He's in Australia. He's a massage therapist. That's a degree. He is a massage therapist. Someone came to him on a freaking heart transplant list, and he fixed them up, and they're not in the heart transplant list, and their heart is totally healed. And they go back to the cardiologist who had put them on a heart transplant list, and they're like, we don't know what's going on here, but your heart is totally healed. You are now off the heart transplant list. Your heart is totally healthy. Now, who else can do that? Which happened, which was a medical doctor came to me as a patient. I've had many medical doctors as patients, but this particular one, this is a pretty cool story. It's kind of funny in a way. Just when I think about it, it's kind of an amusing story, but it really happened like this. He came into my office. He was nice. I liked him. He was a nice, pleasant guy. He looked like he was in his late 30s. I think he was an endocrinologist. Not what I would call a holistic MD, an MD who's, a traditional MD who doesn't, and he told me that he had 3 problems. He told me he had a bladder problem where he was like peeing all the time. He told me he had IBS, irritable bowel syndrome, and he told me he had anxiety, not terrible anxiety, but a little, which by the way, you could not detect that from meeting him. He seemed fine, but he told me he did have anxiety. He told me that he had went to a pelvic floor specialist for 1 year before that day when he was meeting me. I guess one of his colleagues to work on the bladder. He said it did not help him at all. He was not 1 ounce better, the bladder. And he said that none of his colleagues really have an answer for IBS. And he didn't really mention what he had tried for the anxiety, if anything, but he did tell me he had anxiety. And here's the funny part. And he told me he didn't think it was funny, but I think it's funny now. He said, and by the way, I think chiropractic, he's a medical doctor. He goes, I think chiropractic is garbage, just completely worthless. He said, you might wonder why I'm here, considering you're a chiropractor. And I already told you that as an MD, not all MDs, but he thought chiropractic was worthless. But just to quote him, he goes, but I hear you fix people, he said. So he got referred. So I said, yeah, you heard right. And this is how I just wanted to talk about belief systems, but I want to tell you how I approached it in reference to what you said. I think you'll appreciate this. So he kind of was like bewildered on how I could help him because he had already been to the pelvic floor specialist for a year for his bladder. And he kind of thought that IBS was an incurable disorder for the digestion. And he didn't talk much about the anxiety. He just told me he had anxiety. So I said, Doc, let's break it down one by one. I said, the IBS, I said, Doc, don't you think people have been having like digestive problems for like thousands of years? And he's like, yeah, I guess so. And I said, when did they name it IBS? Like 30, 40 years ago? And he's like, yeah, I think so. I'm like, who cares? Who cares? Like, it's a meaningless name. I'm like, I said, listen, Doc, I said, let me tell you something. Tell me if this is logical to you. I said, your body got unbalanced somehow. I don't know how, but it got unbalanced somehow. When it got unbalanced, it's it had been manifesting in these symptoms, which are called IBS.
Mhm.
But doc, when I find where your body's not balanced and I balance it and your digestion's perfect, I think you'll agree you won't have IBS anymore. Because it's one or the other. Like you can't have both. You can't have perfect digestion and
Yeah.
IBS. And he was like, no, I like that. He said, I agree. I said, well, guess what? I'm going to find where your body was not balanced. I'm going to balance it because these zones that I do, and I told him quickly, the glandular, eliminative, nerve, digestive, muscle, and circulation. I said, every cell in your body is somewhere in those six systems. So whatever problems you could have been having was due to a disturbance in one or more of these systems. And I'm going to find out which ones are not balanced, and I'm going to balance them. And I said, everyone heals at their own rate. So I don't know if it'll take a week or a month or 2 months or 2.5 months. But once all your systems are balanced and every cell has been addressed, which they will be, I expect your digestion to be perfect, your bladder to be perfect, and you to be nice and relaxed. And I said, is that logical to you? And he thought, he goes, yeah, it's totally logical to me. I mean, this is a medical doctor. So he started coming and his bladder healed totally, his digestion healed, he was calm as could be. And I even got a video testimonial because he came in one day all healed. You know, he was coming regularly, and about 2 months later, he was all healed. I said, Doc, I don't want to impose on you, but you're a medical doctor. Most medical doctors are not real fans of this stuff. I'd
Mhm.
love for you to give me a little video. And he said, yeah, sure. And we filmed them. It's about a minute. It's like 60 seconds long. And he just said that he came. He had these conditions. They're all better. So anyway, the reason I bring him up is when you hit people with logic and it's, with a positive result, it's not hard to turn a so-called non-believer into a believer pretty quickly.
I agree. Yeah. I've had stuff happen in my own practice where, women would come in and we'd start working, and in 2 weeks they turned into their old self. And their husbands would come in at one point because they had to meet me, and they'd say, when my wife came home and told me what you said, I thought you were insane. and, and he said, but I have my wife back. I said, well, yeah, it's really not that difficult because, again, it is balance. It's all about balance. Whatever system somebody wants to use, it is about allowing the body to do what it needs to do to be healthy. In other words, we get the heck out of the way and let the body heal itself. So, you know, I I have seen plenty of people who don't want to do this or they don't want to do that. Being a naturopath, it's like, okay, how do you want to approach this? Show you the map of where we are and where we need to get to. You tell me how you want to get there. But I think with zone, it's going to cut a lot of that stuff out. It's just not necessary
One thing,
because you can go
you
directly.
you're an ND, am I correct?
Yes.
Yeah, one thing, and I love NDs, by the way. I'm not just saying that to be polite. I really do. I'm a big fan of the naturopathic profession, and I have been since I'm a kid. Because when I was a child, my household was very naturally oriented. We never went to MDs for anything. I mean, anything. And when I was a little kid, we had this is a I was born and raised in New York City. I was living in New York City as a child, and we had three doctors. We had a chiropractor, a naturopath, and a homeopath. Those were our three doctors. So I grew up on that stuff, or with that
Mhm.
stuff. And I'm quite familiar with the naturopathic profession and the history of the profession, and I'm a big fan of it. So I'm already a big fan of it, period. I just wanted to
Yeah.
say something which is a nice addition to a naturopathic practice when someone
Yeah.
knows how to do the zones, and I'm going to tell you what that is that a naturopath who is not familiar with the zones, and again, they're fine without the zones or with,
Mhm.
I already said, I think the naturopaths are fantastic, but a naturopath without the zones, and I can't speak for all naturopaths, but a lot of them are a bit at the mercy of the patient history, meaning
Mhm.
when a patient comes in and they take a very detailed history, the naturopath then has to say to themselves, based on my training, based on my intuition, based on what I know, they've given me this history. I'm putting this together. I understand herbs. I understand vitamins. I understand diet. They might say, well, based on what you said, I've kind of narrowed it down to these two herbs. I'm not sure which one is the solution, but I'm pretty certain one of these two herbs is the answer. The good part is they don't have any side effects. So even if we give you the wrong one, I mean, you'll take it for a couple of weeks, nothing will happen, then we'll know to give you the other one. So a lot of times that's not always, but that could be a scenario in a naturopath's office. But I wanted to say about the zones, the naturopath who knows how to feel the back of the head, it could be the tiebreaker like that because the patient comes in and their symptoms are like, is this more like a glandular thing or a nervous system thing? They're just trying to think. And, one of the herbs is more cut out for the nervous system, one's more cut out for the glandular system. But if they know the zones, they feel the head, oh, glands, take this herb, or boom, nerve, take this herb. So again, at the end of the day, with or without the zones, the naturopath is going to win anyway because they're going to get to the right remedy, but it's just a quick shortcut to the correct remedy. So the zones work really well with naturopathy. Just wanted to mention that.
I agree. I was using all of the naturopathic stuff while I was getting treatments from Sky, and she's an intuitive healer to begin with. So between the two of us, we really were able to balance my body out very quickly, and it was really eye-opening for me because the first thing that happened to me was life came back into my body. And I have to give you a little bit of history with that. I had a herniated nucleus pulposa at L5, and it was bad enough that when it happened, I felt like the lights got turned off. It was like somebody just flipped a switch. And now that is not supposed to happen that far down in the spine that you would have that kind of reaction, but I did. And it was so bad that, I mean, it didn't hurt when it happened, but it was bad enough that several hours later I was dragging my right leg. And the pain didn't really, set in until sometime later. And they kept telling me I couldn't be possibly having that much pain because the cauda equina doesn't go down that far. Da, 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 da. And I said, well, apparently mine does. And so all this stuff that I went through for years and so much pain and so many drugs that they were throwing at me and all kinds of stuff. And to realize now that that could have all been taken care of in a couple zone treatments is aggravating.
Well, I'll tell you, it's interesting.
Unfortunately, I didn't know.
As was mentioned by Michael in the kind of intro. And it's funny because even when I say this, I'm going to repeat what he said, which is a fact. I have different feelings about it, which I'll tell you. But I have had people fly to me from 30 different cities from various continents around the world. I mean, New York, Chicago, Guam, Hawaii, Germany, South Korea, Japan, mainland China, Hong Kong, Malaysia, Philippines, etc. Have flown in to see me. And don't get me wrong, I mean, it's gratifying, but kind of like you said, it was frustrating. I think, like, what are people doing out there? Like, what, I mean, do people have to fly to me for these things? And a lot of them, even though I'd say 80% of my practice overall over the years has been non-musculoskeletal, meaning people have come to me for their circulation, their gynecological issues, their nerve, their glandular system, their circulatory system, things like that, their digestion for the most part. But, some people have come for neck and back pain and musculoskeletal stuff. But interestingly enough, of the people who fly from around the world, 90% of them fly in for the musculoskeletal stuff. And a lot of them were like told they need disc surgery. That's why you reminded me that I'm like, what are these people doing?
Yeah, they told me that too.
They fly in for
Yeah.
a week and they're all better.
Yeah.
Meanwhile, they wanted to cut them open and rip their discs apart. It's really wild.
Yeah. Oh yeah, they told me that if I didn't have the disc surgery, that I was never going to be able to walk or dance or anything like that. Well, I proved them wrong. I actually went to a Hungarian doctor that did homeopathy. That was my first experience with homeopathy. But then I went to the neurosurgeon. He told me that he wouldn't operate unless I only had pain down my leg. And I went to the orthopedist and he said, I will only operate if you have pain only in your spine. And I was like, I've got both. And so then they were like, well, if we did it, we're going to do this and that and the other. And I said, wait a minute. Doesn't that mean that in 5 years from that date, the next one up is going to pop? And he said, yeah. And I said, in 5 years after that, the next one up is going to pop? And he said, yeah. I said, so you're telling me that by the time I get to the end of my life, my entire spine is going to be frozen? He said, yeah. I was like, get the hell out of here.
Right.
So I left and I didn't let him do any of that stuff. So yeah, I mean, it is very frustrating. And I've had plenty of patients that were in that constant pain because of that kind of stuff. So this is why I made my statement earlier that, we need a lot more people doing zone treatments because there are so many people all over the world that are hurting so badly and are addicted to opioids and, just really have no quality of life left. And something as simple as what you're talking about with zone therapy, with balancing the brain, something that simple can give them their lives back.
I'm with you. And
It's a
actually, I think forgetting about the people who have flown in from all over the world, I think if I just think of all the people who have come to me since the mid 90s, hundreds, I don't know the number, hundreds of people were told they definitely need surgery on their neck, their back,
I'm sure.
their their cervical disc, their lower back disc, their knee. They didn't get surgery, and they healed totally. And a lot of those people had already tried and failed with chiropractic. So it's not like just they
Yeah.
went to an MD and they came to me. Many of them had been to 3 chiropractors and were still slated for surgery, and of course didn't
Yeah.
get it.
That's,
Like,
Dr. Pete, so you bring up, because you guys are talking about the brain centers. How come we don't hear more? I mean, the only time I ever hear about balancing the brain centers is when we talk about, zone technique. Why is it not mentioned more, I guess, in other modalities and, it being as critical as it is? I mean, how does that come about with the brain centers and discovering when Thurman Fleet discovered the brain centers? Does no one else really picked up on it?
Well, a couple things. Number one, I don't know. And number two, I can't speak for other,
Right.
I don't know. But I'll tell you something very interesting in chiropractic. And even if someone's not a chiropractor, they can tune into what I'm saying, and it's quite interesting. So if someone's a chiropractor, of course, they'll know what I'm talking about. But even if someone's not a chiropractor and they're learning this idea for the first time, it's really fascinating. So the chiropractic premise, which I touched on before, not the zone premise, but the chiropractic premise. And
Right.
I'm not saying it's terrible, but the chiropractic premise is here's the brain. The brain is sending signals down the cord, and then nerves come out through the spinal column. Those nerves go to various, muscles or
Right.
organs or whatever. And the idea is that if the bones are out of place, the signal from the brain, which is sent down the cord, gets kind of pinched or interfered with. It sends the wrong signal and these things malfunction. But if you put them in place, then the pain will go away or the organs will function properly, which doesn't really happen in chiropractic in general. But maybe the pain goes away, but they're not fixing organs, but that's what they say they do.
Right.
But Dr. Fleet, when he made zone therapy, said, well, what if the brain is sending out the wrong signal in the first place? What if the brain is unbalanced? What if the brain is sending the wrong signal? Then who cares that you put the bone in place to open up the brain signal? You just opened up a faulty brain signal. So he said, let's see what's happening in the brain and let's stimulate the cord properly to reset the brain so the brain is sending out the right signals and also monitoring the body properly. So that's the zone idea with the brain. It does not exist much in chiropractic because 99% of chiropractic is just like, hey, let's just open the signal from the brain. And as far as other healing modalities, I don't know what they would say, but kind of going back to something we said before about what really heals. So let's just say someone has asthma, someone is an asthmatic, so they go to a medical doctor, and I don't know if they still do this. I think they give them a shot of adrenaline or something, and that somehow makes them not have an asthma attack for a little while or whatever. I don't know if they do that anymore. That might be the old days, but they certainly give them an inhaler or whatever. So someone might say, well, there's no real cure for asthma according to a medical doctor, but they can give them an inhaler to kind of make their life manageable. Now, if someone goes to an old school chiropractor, the old school chiropractor would say, well, T3, the T3 bone is out of place, putting pressure on the nerve to the lungs and bronchial tube. So let's adjust that, over a few weeks and get that T3 in place and remove that interference. And then, over the years, there's some people whose asthma have gone away from getting the T3 adjusted. So then you go, wow, I guess the cure for asthma is the adjustment of T3. But then someone with asthma goes to the acupuncturist and they look at the tongue and feel the pulse. They put the needles in, and 6 sessions later, they never have asthma again. Oh, I guess the cure for asthma is acupuncture. Wait a second. Then they go to the naturopath. They listen to them. They examine them a little bit. They alter their diet a bit. They give them some herbs and some vitamins. No, their asthma's gone. Oh, I guess naturopathy is the cure. Or you go to a classical homeopath. They take a 3-hour history, and they say, here's your constitutional remedy. It's tempting to give you an acute remedy because I know you're asthmatic, but let's give you a constitutional remedy, which will not only eventually cure the asthma, but will also just be good for you in general. And sure enough, 5 months later, 3 months later, they have no more asthma. So one might think that homeopathy is the cure for asthma. And it could happen at a Reiki master or even a Christian Science practitioner who doesn't do anything physical, because the Christian Science practitioner doesn't move T3, doesn't put the acupuncture needle in, doesn't give the homeopathic dose, doesn't give the naturopathic herb. They just say, I'm not a Christian Science practitioner, but it probably looks something like this. You're a child of God. Jesus loves you. God loves you. You've just been thinking negatively. Just think positively. God, which is everywhere and all powerful and all knowing, was powerful enough to create, mountains and oceans and clouds. I'm sure God's powerful enough to cure your lungs and bronchial tubes, don't you think? Yes, I think. Good. So I just want you to accept this power that created the whole universe and every cell in your body. And they get into that faith. Now their asthma's gone, which has happened thousands of times. Just check the records of Christian Science. I think it was Mary Baker Eddy was the founder, I believe. Well, Mary Baker Eddy was just relying on this faith in God. She was not talking about the chiropractic adjustment or the homeopathic dose or the acupuncture needle or the herb or even the Reiki energy session. So there is a common denominator in healing, and even talking about it in this talk, people start tuning into it a bit. Of course, I teach it in zone school, but it's just interesting. It's a fascinating topic. Even the last 3 minutes of what we talked about, even if we don't come to any conclusion at the moment, it's fascinating. It's interesting. You'd be like, wow,
absolutely.
That's interesting.
Yeah.
That's an interesting 5 minutes right there.
Yeah, it is. Very, very much so. It brings up, so a patient comes in to see you, or any one of your, graduates. What's the protocol from beginning to end? What is someone out there? So what I'm looking at, we got a viewer, someone's watching this right now, and they're intrigued. Like you said, this is interesting. I want to check this out. What's the protocol that they can look forward to expect when they walk into someone's office, or versus even doing it remotely? And I can speak to remotely too, because remotely does work. It works great. Yeah. And I can speak to doing it in person because I have been with Dr. Pete in person. So I've done both. But just to clarify for someone out there who doesn't have this experience, what is the protocol they can expect?
Well, there's a few things. So let's because you had mentioned about someone listening to this and being intrigued, or however you had phrased it. So there's two kinds of potential people listening, and there might be some overlap. There might be someone who falls into both categories, but one category would be someone who is a doctor or healer. They're someone's listening who is a chiropractor or a naturopath or an energy worker or an acupuncturist or a physical, someone who does healing of some type. So they are a doctor or healer of some type, and they want to join Zone School because they want to learn this. The other category would be considered what you might call a layperson who does not do healing, but they like health topics and they're listening and they want to receive a zone technique session, which, you're kind of asking about, which I will answer. And there might be some overlap. There might be someone who's both. They might be a doctor or a healer who'd like to join zone school to learn how to do it. And they also might want to experience healing. So let me answer the first part first, which is for someone who wants to receive this kind of healing. There's a directory on zoneschoolofhealing.com. So if they go to zoneschoolofhealing.com and find the directory, they will find certified practitioners. There's different kinds of certified practitioners. There's what's called mastermind certified practitioners. There's advanced certified practitioners, and there's certified practitioners. Now, theoretically, anyone on that list should be valid. But not surprisingly, a mastermind certified practitioner is probably pretty good.
Good. Yep.
Advanced certified practitioner is also probably pretty good. And of course, a regular certified practitioner, hopefully knows what's going on. So that's where someone could find that. And of course, if someone wants to join Zone School and learn what I'm teaching, I'm sure that Michael and his group will put the links, and there's actually
We will. Yep.
pretty significant discount for you guys because Zone School costs $24.97. But you guys have a pretty significant discount, which I will let Michael post and explain to you. And we don't give discounts. If you look at Zone School, we don't have like sales and give discounts. It's $24.97. That's it. In general, Zone School is not the discount type. It's $24.97. But for your group, there is a discount, which I'll let you talk about after. But the point is, if someone wants to join Zone School, you can use the link that Michael will tell you about or post or both.
Yep.
And then the basic course, you get immediate and lifetime access to 60, that's 60 hours of me teaching you online. You can watch it at your own pace. And part of that is 8 weeks of live Q&As with me. So every Sunday at 3:30 Central Time for 1 hour, there's a 1 hour Q&A with me, and you get 8 weeks of that. So as you're going through the 60 hours of knowledge, you have 8 hours to ask me questions. And then, of course, we have, which is also on the Zone School website, zoneschoolofhealing.com, the live seminars, which are optional and supplemental. That's not the way to learn. The way to learn is the online program. The in-person seminars, which you should take because they're amazing, are optional and supplemental. And again, Zone School, whether it's the online program, which is the way to learn, and or the in-person seminars, is open to doctors and healers. You have to be a doctor of some type or a healer of some type. Now, with that said, to answer the question, when someone goes to a zone certified practitioner, the person is going to check their zones. If it's in person, by gently feeling the back of the head. If it's remotely, they have a way to figure that out. And then there's certain points in the spinal cord that are gently stimulated. It could be with a gentle chiropractic adjustment. It could be energetically. It could be by light touch. And it takes, a few minutes. And once the points are stimulated, the back of the head is rechecked to see if the brain center is healing, which it should be. And then they'll probably tell you to come in, it depends who it is, maybe weekly for X amount of weeks until you're healed. And I just want to say this, the way I look at healing, just as an example, if someone came into me, a new patient on the first visit, and they told me they have period cramps, period cramps, insomnia, digestive problems, and neck pain, well, I would like to work on them until their period feels perfect. They sleep like a baby. Their digestion is perfect and their neck is totally healed. So, they come weekly for, a few weeks. I would expect that to happen. So that's the progression I'm looking for. They have their list of what needs healing, and we're going to work on them until that whole list has been deleted out of their body. And I'll just say this in closing, when it comes to the brevity, if you want to call it that, of the zone technique session, I remember I had a guy fly into me from Malaysia. He was told, he was a professional athlete, professional fighter, Malaysian guy. He was told in Malaysia when they looked at his MRIs that he needed disc surgery on his neck and his low back. And if he kept fighting, he was going to end up in a wheelchair. They told him all this stuff like this. This guy flies from Malaysia. It's quite a long trip, I'm sure. My first visit with him, I listened to him. It might have been 10 minutes. I had to listen. My session was 2 minutes. I mean, he came from Malaysia for that. Kind of looked at me, but then I told, when they fly in, I said, I'll see you every day for X amount of days. He flew back. He was fine. In fact, on the Zone School website, I don't know exactly where. I think it's under founder, I think, which is my bio kind of. His name was Albert Lim, and you can hear it because he's a famous guy. So he was interviewed on a radio show, and we actually put that little audio clip. It's like a minute. It says
Right.
Albert Lim, famous fighter, flew across the world, had a few quick sessions. So my attitude is I never try to do a session quickly for the sake of doing it quickly. It's just that's how long it takes. I remember when it comes to how long it takes, that lady, and I'm only mentioning this not in a religious sense, I'm mentioning it in a healing sense. Of course, religiously, anyone can think what they want to think. That's their choice. But in a healing sense, there's the famous healing story where that lady went to Jesus and she had like some kind of blood disorder, and she just had in her mind that if she could just touch Jesus's clothing, her blood disorder would heal. And that's exactly what happened. Well, how long did that take? That took just a few seconds.
Instant.
And some people might say, well, I mean, you're talking about Jesus, but actually, to quote Jesus, he said, it's not I who heal, it's the Father within. All these things I do, you can do too, and even greater. So take his inspiration.
My shamanic teacher years ago said the first job of a healer is to instill faith. And he wasn't talking about faith in a particular religion, but just to have a belief system that you can be healed. And yeah, I've seen some miracles, quote unquote, miracles happen when it's really just, it's our right as a human being to be able to heal like that. The body was made to regenerate and to be healthy. So, I like to tell people that at the start. Your body is supposed to regenerate. So let's figure out what the block is.
Yes.
Remove that block and it'll heal itself. And then we call it a miracle. That's the way the body's supposed to work.
Well, actually, Dr. Val, you would like Dr. Fleet because Dr. Fleet would often say that exactly in line with what you said. He used to say, health is the normal state. It's actually normal to be healthy. Yeah. That's normal. So that when you come to Dr. Val or some other great healer and then you get healed, you're just being brought back to normal. That's normal. It's normal to be healthy. Great.
Yeah, that's what balance really is.
Yeah, and the one thing with the Zone, that I've liked, my experience with it, and I know you've mentioned this before, Dr. Pete, is people out there is how quick it does, the results come. And I know you can't pin on it, because people ask, well, how many visits do I got to go? One visit may be all you need.
Well, my answer to that, excellent point. First of all, you're right. One visit may be all they need. Jesus did it in one visit. Yeah. With that said, what I tell my patients, and I've told them for decades, when they come to me and say, how long will it take? I say, I don't know, because everyone heals at their own rate. But I tell them, you show up weekly for a few weeks. I expect you to be all better.
Right. Oh, I think that's great. Yeah. How many, because I don't know how many different, like I said, not to get on any different modalities and negative there, but a lot of things out there, you can get strung on for quite a while, especially in the allopathic world. Allopathic world, they want to string you on. Yeah.
Isn't that what they teach too in chiropractic school? I mean, I love chiropractors, and I've been going to chiropractors for a long time. And, I've had friends that are chiropractors, and they told me that was part of the business program. They teach you to have these people come in, so many visits for so long. And I was like, wow, I'm not too sure I really like that.
Well, I can tell you a few things about that. So first of all, D.D. Palmer, the founder of chiropractic, the first chiropractor, D.D. Palmer said to his students, if it takes you more than 5 adjustments to help anyone heal from anything, you're doing it wrong. Come back for a refresher
Like
course.
that.
So D.D. Palmer
Yeah.
definitely wasn't with that, Dr.
Right.
Val. That's number one.
And
Number
I was
two,
always looking for a Palmer
yeah,
DC because
number,
that's the only stuff that actually ever worked on me as far as chiropractic. So yeah, I am a fan of Palmer.
I have hundreds of Palmer graduates in zone school taking themselves to even higher levels. So I was going to
Oh
say,
wow.
number two, I want to say is what I've always told patients is come weekly till you're healed. That's it. Come weekly till you're healed. And they say, how long? And I mentioned already what I said. And I would add to that, everyone heals at their own rate, but a month and a half, maybe 2 months is usually all it takes. So that's that. And then lastly, just wanted to say that at least when I went to chiro school, they actually didn't teach us that. But unfortunately, and I've actually never been a member of one, but there's a lot of chiropractic practice management groups that unfortunately teach just to give people these ridiculous care plans that they absolutely don't need just to extract money out of them, which is kind of sad. But of course, that's got nothing to do with anything I'm interested in or ever even
Me either.
I just heard about it because I never actually was in a practice management group. But just want to really clarify before we leave this topic. When a new patient comes in, I tell them, come weekly till you're healed. Everyone heals at their own rate. I don't know how long it will take exactly, but if you come weekly in the not too distant future, I expect you to be healed totally. That's how I leave it at that. Just for this talk that we're having now, I can tell you if someone comes weekly to me, I mean, within 2 months, 90+% of them are 100% healed.
That's what's
That's
great
pretty
about it.
impressive.
It is impressive. It's results orientated is what I like about it. It's results.
too.
And I will testify to that. And for people watching this, trust me, it's very results orientated, as much or more so than almost any healing modality out there.
I can tell you it made a huge difference for me. And I did all my sessions remote. And like I said, the very first one, I felt life returning to my body. And I had all kinds of stuff going on. And it was very complicated. And so I did a session every other week for several weeks. And I can tell you that it really did change my life. And I had already done all the naturopathic stuff I could do and the chiropractic stuff and the homeopathy. And, you name it, I was after it because I just couldn't take it anymore. It was just constant pain and disability. And it was like, this is ridiculous. I was always super healthy and strong. And, all the dominoes started falling with that first HNP that happened. And so to be able to talk to somebody over the phone or on Zoom and have that big of a difference happen, not only the first time, but every treatment that I got of zone technique was amazing. And I would love to just do that constantly. So I'm not right now, but I hope to pick that up again and to learn it myself. And it's really worthwhile for people to get into this, whether you're going to do it as a business, or teach it to other people, or whether you're just needing to get out of or off of the treadmill of constant pain and disability. I highly recommend it. And it'll change your life. So I'm very grateful to you, Dr. Pete, for bringing this out and for helping so many people learn how to do this technique and to encourage them. You're a constant source of encouragement for so many people. And I appreciate that. As a human being who wants to help people, I appreciate that you do that. So thank you. Thank you for your contribution.
That is a very, very sweet thing, and I take it very sincerely. So thank you. Thank you for that.
No, I can ditto that too. It's great. We could use more zone healers out there. Yeah. The more, the better. Yeah, I agree. Well,
Absolutely.
if Do we have anything else? Do we want to pull out of Dr. Pete's mind? Or we about
I have one thing. I
okay.
have a half woo question for you.
I'm ready.
Okay, it's going to be really weird.
I've heard it all. Don't worry.
We like woo woo around here, so that's okay.
Yeah, and like I said, I'm half and half. Half science, half woo woo. So, what do you think is going on with exploding brain syndrome? Where people hear a crash and there's nothing around, but they hear explosions. And I mean, they're loud. It's like they're really happening next to them or close to them. And they have this fairly frequently. Have you heard of that?
Well, I have a couple things to say. I have not heard of it until this second, but I have a thought about it. So the first I'm hearing it is this second. I'm unfamiliar with that. But I think that the world as it is now, not to say the world is worse or better than it was 10 years ago or 50 years ago or 100 years ago or 200 years ago. I'm not making any comparisons like that. I'm not making any grandiose statements about the world, but the world as it is now, however it is, I think there's so much input to people. Like it's from the moment they wake up, like grabbing their phones and like seeing, all kinds of images, some real, some not real, some violent, there's so much conflict and so much of like the survival mode that many are put into just based on what's happening. I don't think it's surprising that people are having like these, for lack of a better word, like these mini hallucinations on the violent side, like you just described. So that's what comes to mind when you mention that. Again, first time I've heard of it, but I think just the way the world is set up now, I'm not surprised that that has become a phenomenon for some.
I'm just wondering, what system would you put that into for zone technique? Because I mean, it's obviously happening in the brain. It's not really happening in the ears, as far as they know. I mean, they
I would
really don't
guess,
know.
I would guess it's what we call in zone technique, zone 3 nervous system, but I don't know because maybe it's another system that's affecting them somehow. Maybe the glandular system, I don't know. But if I had to guess, I'd say the nervous system.
Yeah, that's what I was thinking too. But being half in woo woo, I was wondering if it's that people are actually more open to the astral plane,
It could be
because
because
that's
there's an idea, and I certainly don't know if this is true. So I'm just saying I've read this. I have no idea if it's true, although it may be. But those who astral travel when they sleep, possibly, supposedly there's this silver cord from your belly button to like your astral body, and then you kind of come back into your normal body. But well, I don't want to say normal body, but your so-called physical body.
3D body.
Right. And some people say that when you don't kind of land properly in your body, you kind of sometimes you wake up like this, you wake up like shocked. And that's because of a kind of a astral travel that didn't end smoothly. Again, whether that's true, I don't know. But if that is true, and maybe it's somehow related to what you brought up and your explanation, certainly could be. I don't know for sure.
Yeah, I wonder. I've been wondering about that for a long time because I've done a lot of travel. And by the way, I never saw a silver cord. So whether
I
it's
have
true,
heard that before, though, the silver cord
yeah,
thing. I've heard that
yeah,
before.
I've heard it for years. I've never
Yeah.
seen it on me, but I'm a little odd, so who knows?
For those who like to read books on that, and again, I am not an expert on this topic at all. However, I read some books by this guy, Tuesday Lobsang Rampa, who's a Tibetan monk, and he talked
Yeah.
about it. I think he wrote about 14 books. His first book was called The Third Eye, which was a good book. And his second book was called A Doctor from Lhasa. I think it's
ASA.
ASA. It's like a city in Tibet, I believe. That is a great, 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 great book. Now, by the way, some people don't like Tuesday Lobsang Rampa because they say that he was a fraud because apparently he was like a plumber in England and he wrote all these books. But he's they call him like a walk-in, where the spirit of this Tibetan monk just went into this plumber who didn't know anything. And all of a sudden he wrote like 14 or whatever it was of the most detailed books on Tibet. And even the Dalai Lama, not the current Dalai Lama, but a couple Dalai Lamas ago, he read one of this guy's books and he was like, this guy knows too much. He's saying too much. So I'm not an expert in the topic. All I'm saying is, and I don't know how walk-ins work and any of that stuff. All I can say is that book, the second one, Dr. from Lhasa, masterpiece. I learned a lot about healing in that book. And they mention these topics with that we're talking about with the silver cord and the astral travel, which is why I'm bringing it up.
Well, and I think it's all combined. Like in my practice, I always combined all the spiritual aspect, not religious, but the spiritual aspect and dimensional aspects and things like that. Because I found that when I'm working on somebody to do a healing, sometimes I will get a vision of what's actually wrong with them. It has nothing to do with their physical body. It has to do with something that happened on another plane of existence. And so if I send the energy into that and fix that, then they're completely healed. And it's like, okay, I wasn't expecting that. Like I might be doing acupuncture on somebody and all of a sudden, I'll get this vision and send the energy and, into that dimension or, whatever it is, and then fix it. And then they're healed. And it's like, okay, that was kind of interesting. Now, how am I going to explain that to somebody who's, completely left brain and doesn't believe in any of this stuff? But,
the good part
I'm
is
always looking for more. I want to know what other people have found out.
the good part is when you mentioned explaining it to someone who's left brain. Hey, the good part is when their headaches are gone or their digestive problems are gone or whatever's gone, they're going to be happy. So
yeah, I like that. I actually love
Very
that
happy.
very much. So
Yeah.
yeah, very cool stuff. I hope that people will really look into at least getting zone technique treatments. And hopefully the healers that hear this will really look into and hopefully complete the program and learn how to do this to help others. Because it really, truly, it's quick. It's not that hard. It's not physically hard or anything else. And it's a great adjunct to have to add to your healing techniques. Most of us healers have all kinds of techniques that we use because people are different, But I think that zone technique spans all of those and works well with all of them and is a heck of a lot quicker. So again, thank you.
my pleasure. Thank you both.
And here's the link. This is the place to get your greatest, best discount on that. At the end here, you'll have a link below. go.zoneschoolofhealing.com/wonder. So again, for everyone, go.zoneschoolofhealing.com/wonder. You will not get this discount that we have anywhere else. So all you healers out there.
There are people that want to be healers.
Yeah. I mean, from Reiki masters, other chiropractors, energy healers, naturopaths, homeopaths, any of that, I highly recommend. Yeah. What's that?
Martial artists too.
Martial artists. Yeah. Martial artists. Yeah. So definitely look it up. So I want to thank Dr. Pete again for showing up and giving a fantastic interview. I'm going to thank my lovely co-host, Dr. Val. And I think there was a great connection there. It was great to see. I'm glad you're here, to interact with Dr. Pete there, because I know there was you guys had a lot of connection there, how this relates to everything. And
I'm sure we could get in some really interesting conversations.
Yeah, we could get in some more. We could do another separate show, just even a specialized show. I think there
anytime, guys.
Between you two.
Anytime.
Cool.
So
I would love to. I have lots more questions, and half of them are woo woo, and the other half are scientific. But yeah,
good. I like both.
Let's let's do some more.
We'll do again,
and
we'll do this again.
Yeah. I have plenty of weird questions to ask you. There's no shortage.
More the better.
We'll save them for the next show again. We get Dr. Pete back. So I'm Michael Lane. And this is the Wonder Network. Thank you for watching, and we'll see you next time.